also know that between 21 and 23% of all children live in a family with a parent with a mental illness. So it's very common. It's 1 in 5 families have a parent with a mental illness. We also know that we think that we can actually reduce the cycle, and this is based on 11 different studies around the world, that we can reduce the impact of the illness by about 30%. So around 30% less children will develop a mental illness themselves. We have a cast of thousands involved in the project, but it's a wonderful project that's looking at how we can integrate a parenting empowerment process within recovery models for people with mental health problems. The idea is that parental mental illness impacts on children, and we're looking at ways that we can intervene in the adult mental health service and also the family sector to make things better for families, basically. We think we can break the cycle of mental illness in families.
If we support important roles in people's lives, we believe that it will help people in managing their mental illness and help them feel a bit of a sense of empowerment and a sense of well-being that comes from supporting that role. We also hope that actually looking at the way services support families will actually lead to greater outcomes in terms of people going through the mental health system as well. A major arm of my work is working with a number of mental health services, working with a number of statewide services, and working with the Victorian government to translate our research into practice change with workers, with mental health workers. So a core arm of that, I guess, is implementation science. So it's a new sort of field where we look at, if we have this great model of operating, how do we translate that into practice change out into the real world?
We also work really closely with the Children and Parents with a Mental Illness group, the National COPME group, and also with the Victorian FAPME strategy. And we do research with and in conjunction with those groups as well. So there's always opportunities for students to do projects. And we've probably had 20 students work on projects over the last 5 years in this area, so it's a very a welcoming area of research, and we call it the FAPME and COPME family